what do? Our girls start their period when they're 12 or 13, then we slap them on the pill, and then they're on the pill until they're ready to get pregnant. And then they've disrupted that whole hormonal cascade pretty much their whole lives. And so that's another contributing factor, I feel, that's causing infertility.
Do you want to wake up feeling like you're stepping into who you're meant to be, into the best possible version of you? What if I told you that the key to your best life, health, and happiness are all around you? You just have to find what works for you. I'm Hope P.U.Z.Z.L.E, and I believe that there isn't just one way to live a healthy and meaningful life, and that all you need is a little inspiration to make changes that last from the inside out. Each week, I'll be sharing tangible tips and inspirational interviews to help you on your journey. These are the steps to take to improve your life and live with purpose. This is Hopeful and Wholesome. Hey y'all, welcome back to Hopeful and Wholesome. Today I have on the show Dr. Kela Smith. She is a holistic integrative fertility and hormone doctor who specializes in fertility, hormones, and pregnancy. She had her own personal struggle with infertility, and she successfully conceived by implementing her Hormone P.U.Z.Z.L.E, which is an acronym, her Hormone P.U.Z.Z.L.E method, which basically takes a holistic approach to preparing the body for pregnancy from the inside out. And that is what we're talking about today. We were talking about kind of solving this hormone fertility puzzle, if you will, using holistic and functional medicine. And she talks about the P.U.Z.Z.L.E method, which is her own method that she has created. We talk about the role of lifestyle and food and all of these parts that play a part in just optimizing hormones and optimizing fertility, and how it's never too late. And fertility is really not a thing. There's always ways to improve the body, to help the body conceive naturally. So let's jump in. All right, y'all, let's jump in. I'm here with Dr. Kela, and we are talking all about fertility and the hormones and all the things that Dr. Kela is an expert in. So thanks so much for joining me today.
Thank you, Hope. I'm excited to be here.
Me too. So I was on Dr. Kela's podcast, the Hormone P.U.Z.Z.L.E podcast some time ago. So she is all about the hormones, and we're going to talk about her Hormone P.U.Z.Z.L.E protocol. But Dr. Kela, if you could just kind of introduce yourself and just give us kind of some insight on what you do and how you specialize in hormones and fertility.
Sure. So I'm Dr. Kela Smith. I'm a doctor of natural medicine and a functional nutritionist and a health coach. And I work with couples all over the world who are struggling with some sort of hormone issue, whether that's infertility, hormone imbalance, maybe they're in menopause, something's going on with their hormones and they need to help to fix and optimize. I also do pregnancy. So once you are pregnant, I help you stay pregnant and have a healthy super baby. So all the gamuts of that, I work with men and women all over the world. So yeah, that's a little about me. And I have my own podcast, like you said, the Hormone P.U.Z.Z.L.E podcast, lots of books and programs and different things that we're going to dive into here.
Yes, I love it. Perfect. So many things to talk about there, just regarding fertility and hormones, all things. It can be such a complex subject. I feel like there's so much involved in hormones, and especially with fertility, and there's always two sides of the story. I feel like a lot of times we talk about in terms of women, and I feel like, and maybe this is just me, so I'd love to hear your thoughts on this, but I feel like when we talk about fertility, for the most part, I'd say, in my opinion, like 99, maybe 98% of the time, we talk about it from like a woman's perspective. Like we're putting it all on the woman, but there's two people that play a part in this. So it's not always just a woman's issue, right, with fertility. So why do you think, and just from your experience, why do you think so many people are struggling with fertility? And what does it look like in terms of like from the male versus the female, like issue perspective?
Yeah. So men and women are 50% of the equation.
There.
Two people. And so, yeah, I think though we focus so much on the women piece because women are the ones carrying the baby. So,
right?
Yeah. It's almost like we have more, say in it. We have more control over what's happening and why it might be not happening. It is both. It's both. And so, yeah, I like to look at the couple. I like to look at both their healths and see where we can fix and optimize, see if there's anything going on there, and really work to help them, fix things holistically. And I feel like the reason why so many people are struggling with infertility is one, just the state of our world, the state of our environment, from the foods that we're eating, the chemicals that we're surrounded around, but then also just the stress of our world. This is the highest stress time that we've ever lived in as a society. And I feel like that's jeopardizing our fertility. The body doesn't feel safe. It's not going to procreate. It's not going to allow that to happen. So I think those are really the main things that I'm seeing, is just a lot of people are struggling with the hormone imbalances because of their diet, their lifestyle, their stress level, all of that, and the toxins.
Yes. Yep. It makes so much sense. And I mean, there's so much to attribute that, like the kind of what you're saying, like the state of our world. There's so many other things we can attribute to. Like I always think about, I was just having a conversation with a friend of mine, like how early girls are starting their periods and, going through puberty. And it just seems like I just hear like younger and younger girls like starting their periods, which is crazy. But I think there's so much of that we can attribute to, like you're saying, the environment, toxicity, like all of that plays a part.
For sure. All the hormones that are in all of our foods. Yes, that is causing more and more. And then what do? Our girls start their period when they're 12 or 13, then we slap them on the pill, and then they're on the pill until they're ready to get pregnant. And then they've disrupted that whole hormonal cascade pretty much their whole lives. And so that's another contributing factor, I feel, that's causing infertility.
Absolutely. Yeah. And I had a conversation on another podcast I was on about that, and just how we don't realize how much the pill is really affecting, like you're saying, it's disrupting kind of the natural, like function of our hormones. Right. And then not only that, but like what we were talking, I'd love to hear your take on this. We were talking about was how we're in, I'm assuming they're around the same age. Like we grew up in a generation where, like you're saying, you start your period, you have a vagina, you're on the pill, right? Like that's basically it. Oh, you have a vagina, get on the pill. And so now we're in the same generation where there's, like, we're talking about fertility, right? There's these increased risk or increased instances of infertility and depression and anxiety and PCOS and all these hormonal things. Like, are we not putting the pieces together? Do you know what I mean? I'd love to hear your take on that. Just your thought on the birth control situation.
Yeah, 100%. I mean, the birth control pill was designed to stop the flow of hormones so that you don't get pregnant. But I always say, if you were to read that pamphlet, nobody would ever take that junk. And
absolutely.
It was by a man. Let's talk about that for a minute. Men would never put that junk in their body. So, and when you put a girl that young on the birth control pill, it does, like I said, it pauses all those hormones. It stops her from ovulating. It stops the release of estrogen and progesterone. So then when she gets ready to get pregnant, her body doesn't know how. It doesn't know how to make those hormones anymore because it hasn't done it in so long. And then I feel like you go to your doctor, they say, well, you're on the pill, you've been struggling with infertility. Well, let's just do IVF. We'll just do IVF. But what most people don't realize is if the body's not ready for IVF, it's not going to work in the first place. And so it's really looking at, okay, you've done the pill, it's caused some hormonal issues. Let's fix those hormonal issues and get the body to work the way that it was made to work. And then you might not need IVF. Not to say that IVF is bad, but you just might not need it.
Right. Yeah. I mean, and that's what I had another gal on, we talked about IVF, and that was kind of what we were talking about, where, IVF is obviously a viable option, and sometimes it's necessary, but it's such an expensive and intensive process that sometimes it can be avoided. And I don't think many women are given a choice. It's like they feel like the only choice they have is, to go that route.
For sure.
And it's expensive. And okay. So speaking of fertility, so if we are looking at ways to optimize fertility, right? And you are doing things, from a holistic perspective, are there foods that we can be taking? Are there supplements we can be taking? What are things that people can do to kind of help optimize that process?
Sure. So I am a big fan of test, don't guess. What needs to be fixed and optimized before we just go throwing things at the wall. Now, that does not mean that you should not lay foundational groundwork. If you're eating McDonald's every day, a test isn't going to tell you that you need to stop eating McDonald's every day. So making sure that you've laid that foundational groundwork, that you're eating whole food, clean, balanced nutrition, you're flooding your body with nutrients and not being afraid to eat food. I see so many women struggling with fertility that are under eating and over amazing.
Mm-hmm.
So eating real foods, eating whole foods, lots of vegetables, a little bit of fruit, nuts and seeds, more of a Mediterranean style diet, some fish if you're a meat eater, a little bit of red meat's okay. Don't go crazy with red meat. You don't have to have a 16-ounce steak every single night. A little's fine if you like it, but you can completely eliminate it too if that works for you and just do some fish and maybe a little chicken here and there. But whole food nutrition, making sure you're adequately hydrated is another place I see a lot of people are missing. I'll ask my patients, how much water are you drinking? And they'll say, oh, about 30 ounces a day.
Oh my gosh.
You need to be drinking water. You need to drink 2/3 of your body weight every single day in water. So making sure that you're doing that, staying adequately hydrated. You're adding some electrolytes as well. This is another place I see if people are drinking enough water, a lot of times they're flushing their electrolytes because they're drinking too much and too much at once.
Yep.
So adding a little, even putting a little, sea salt in the water, putting a little, drinking a little coconut water every now and then to get some potassium is going to be important. And so those things are kind of foundations. Also, what you put on and around your body. So looking at all your environment, are your body lotion and your face creams and your, body washes and anything that goes on and around your body should be non-toxic or no toxic. So be really careful with that. And so those are the foundations I really like to look at. Obviously, stress plays a role into that, sleep, exercise, all of that needs to kind of be on point. If you're listening and you're like, I don't know where to start, that sounds like a lot. I always say, just pick one place, one place that you're going to start and then, dive into that, optimize that piece, and then add stuff as you go. So those are some places I would say start there first, see if all that's done. But then again, I'm a test, don't guess. So let's dive into maybe some more functional tests, looking at your hormones functionally. I like to use dried urine versus blood because blood's only a snapshot in time of what's happening right when hormones are tested. Doesn't show fluctuations. It doesn't show methylation, which means neutralizing, detoxing, or excreting. So that's kind of the other side of that hormone puzzle that I like to look at and say exactly what's going on. Are there any root causes of what needs to, what's happening in here, what's causing some of your symptoms, especially if you have infertility. So I do the Dutch test. I also will do a microbiome analysis. I find this is another place a lot of practitioners will miss and a lot of people will miss in general. If you have dysbiosis, more bad guys than good guys, if you have parasites or fungus or a lot of inflammation, if you have a leaky gut, all of these things can contribute to infertility. So diving into what your microbiome looks like, who's there, how they're interacting, what's that environment look like is going to help because that's going to affect hormones. It's going to protect fertility, all of those pieces.
Right.
And the last place I like to look is through minerals. I like to look at your minerals in your hair because so many people are mineral deficient.
Yep.
We just talked earlier about toxins. Our soils are depleted.
Birth control.
Birth control. So really looking at your minerals. I like to do hair versus blood again, because blood is just a snapshot. It's just a transportation vehicle. It doesn't show what's inside our cells. So once we kind of look at that, we can say, okay, your minerals are low or imbalanced. They're affecting your thyroid. They're affecting your adrenal glands. They're affecting your fertility, your hormones, all your symptoms. Yeah. So those are kind of the three I like to look at and kind of say, okay, once the foundation is laid, let's dive into some more testing. And then let's get even deeper into those foundations and say, are there specific foods that you actually need for your body, your biochemistry? Are there certain supplements that you need? Are there certain lifestyle pieces that are going to benefit you more than another person?
Right.
So really kind of tailoring it even more to what you should be doing for fertility and hormones.
Yeah. Yeah. You are speaking my language because those are really the three main labs that I do, the Dutch, the GI-MAP, and the HTMAs. So speaking my language, do you find I guess, generally speaking, do you find that any of those three typically tell you more than another? Like, is there one that you find is like, I find the most, information or like revealing parts of why, the infertility is happening because of this test? Or is it, I mean, obviously the combination because you want a lot of the data, but is there one test you find that usually tells a big part of the story?
It depends on their symptoms. So if I feel like they have a lot. So when somebody comes to me, I'm sure you do the same. I have them fill out a very in-depth health questionnaire, and I'll look at that and I'll base it around the symptoms. Obviously, if your budget allows, those 3 tests are my favorite because they will kind of correlate what the other one is saying. And it allows me to look at those body systems and say, we can rule this out. This is a problem, that's a problem. But obviously that's expensive. Most insurances don't cover these functional labs. So I will look and say, based on your symptoms, you're having a lot of gut symptoms. Let's do, the microbiome test first. Having a lot of hormone symptoms, you're having irregular cycles, you're having, no cycle, you've had a lot of infertility for a very long time. Let's look at the hormones. And so that's kind of where I'll dive in. Minerals, sometimes I'll do that. Minerals is the least expensive one to run.
That's why I like it.
Yep. It can show, like I said earlier, the thyroid and the adrenals. So if that's, if you're like, I don't have any money for testing, I just want to kind of get started, that's one I'll usually choose to kind of get started, see where we're at, see if we can fix and optimize, see if there's anything that test shows, and then, treat. And sometimes that's all they need. Sometimes it's that simple, if you will, in quotes, simple. And we fix some things and, we optimize their adrenal glands, we get them out of fatigue, we help their thyroid, and then they're pregnant, or their symptoms are lessened. So it really depends on the person on which one I choose first.
That makes sense. And then speaking of kind of the timeline of things, I think this is another part which I get it. Like when you want a baby, you want a baby yesterday, right? Like we want it to happen. But I know there's also, value in keeping a realistic expectations and a realistic timeline. And I know it's obviously going to depend on the person, like you were just saying, but just for people listening who maybe they're struggling with infertility or they have a family member or whatever, like how long can we expect it to take, right? With the changes. And again, keeping in mind that it's going to depend on the person. Do you have kind of a general guideline of like, well, let's give it this amount of time, and that's kind of a rule of thumb?
Yes. If you can give yourself 90 days minimum, that's going to be the life cycle of your eggs and your partner's sperm. So 90 days, what you ovulate today is the egg you started to formulate 90 days ago. Same with sperm. What they ejaculate today, or what the male ejaculates today, is what he started formulating 90 days ago.
Makes sense.
You can give yourself 90 days. That's kind of gold standard. That doesn't mean it's going to take 90 days because everybody, like you said, is different. It depends on where they started. You might come in and you've already been doing many of these things for many years, and you just need a little help, a little push. And in 30 days, you're pregnant, or in 30 days, your cycle is back on track and you're ovulating. And so we can pinpoint when you need to have sex. And then the next month you're pregnant. So it can be that fast, or it can be, at least 90 days. If you're going into IVF, I would say definitely try to do the 90 days because you don't want to have to repeat that. You want to first time. Try, I have people, my patients will come in and they'll be like, I want to start working with you. And our IVF is in 2 weeks. And I'm like, well, we need to pause that, start this first and then go to that. And then I always tell my patients too, that this is a lifestyle. It's not like a diet you're on for 90 days and you go back to your old ways. You're going to do this for the rest of your life for your health, and your fertility is your health. So you need to do this and start to implement these changes and make these habits and do it for the rest of your life. And you'll start to see changes immediately, but it just depends on the person on when the pregnancy will happen and how long it'll take to see your final changes.
Right. Yeah. I like that though, having at least kind of a benchmark so we can give people, so it's not like a definite, like, oh, let's, see what happens next year or whatever. Yeah. So that's always good. Okay. So I'd love for you to kind of talk through, your puzzle, the hormone puzzle protocols. This is what you do like with all of your patients. So can you just talk a little bit about that and what that looks like?
Yeah, sure. So the puzzle is an acronym, and this is the foundational pieces that I was talking about earlier. And I created this out of my own personal struggle with infertility because I felt very out of control. When I was going through it, I had unexplained infertility and the doctors were like, we don't know what's going on. And I felt very out of control. A lot of things were happening to me, and I wanted to wake up every day and be able to take some of that control back. So I created this, and then now this is what I use with all my patients, and it's a way for them to take back their control. So puzzle, again, it's an acronym, and it stands for P is proper whole food nutrition, U, understanding supplements, Z or is zapping stress, Z or Z's, sleep, L is love and encouragement, E is exercise and environment. So those are all the places you need to think every single day. What can I do in this part of my life to optimize my fertility? And, again, you don't have to do all of that every single day, but just kind of dive into one piece and start to work towards that, develop those habits, and then you can dive into the next one. Those are all the foundational pieces that you should really think about that are going to make the biggest difference.
Yeah. Well, and I think just, you listing those out, I think all of those are applicable, even if fertility is not your goal. Like those are just like you're saying before about the diet. Like this isn't a diet you're going to do for 9 days and then go back. Like I think these are just like things to live by, like forever, right? These are just kind of the like the gold standard of, yeah, exactly, for health. Yeah. And wellness. So I think that's such a good like resource to have moving forward too, for people who after, fertility, and just for people in general and women in general, I think would be really super helpful.
Yeah, for sure. Yeah.
How do you find, or do you have like a story that sticks out in your head of a client? I know you probably have a ton of them, but one that's sticking out for you of kind of going through this process and like working through the puzzle protocol and getting these foundational pieces in place. And then, you're doing the labs that where it just, everything kind of just worked and fell into place. And then, the end result was, of course, the pregnancy.
Yeah. So I've worked with thousands of people all over the world, and I have a lot of really difficult client cases, but I was working with one lady. She had unexplained infertility. She hadn't had a period in 10 years and she didn't know why. So she came to me and she was kind of like at her wit's end, was like, I don't even know if this is going to work, but we're just going to try it and see what happens. And so we ran all 3 of those tests on her. We found out that she had estrogen dominance. She had estrogen, her phase 2 metabolites, and that pathway was blocked. So she was recirculating that estrogen. She had some thyroid issues. She had some gut issues. So we kind of worked to fix all of that, implemented the hormone puzzle method. And then she got pregnant after 10 years of, at this point, it was like 11 years because we were working together for about 6 months, but she got pregnant, got her period back, got pregnant. And then she was like, I never thought this would happen. I don't know what to do now. Now I'm pregnant. Now.
But that's crazy.
Very cool.
10 years. That's nuts. It's crazy to me, like for someone like that, who it's been that long. And I can't imagine how many doctors she had been to. And I know, I have that happen a lot in my practice. I know that happens to you all the time where, they've gone to literally every doctor under the sun. And I have my own opinions about this, but I always like to give other functional practitioners opinions. But I would just love to know your take on like, why are doctors not talking about these things? Like, why are we, I say allowing, but why are we allowing these women to go through this, what can end up being a really stressful time in their life, which like obviously complicates things even more because now we're stressed about having a baby. And then the stress of not having a baby is more stress on you trying to have the baby. It's like why are we not like, yeah, it is. And like, why are doctors not recognizing that there are pieces that they're not connecting right with these women and allowing, like this woman went 10 years without a period. That's insane.
Yeah. And it's 2 different branches of medicine. I always say, a functional doctor, we're trying to heal and optimize the body. Whereas a Western medical doctor is looking for symptoms. And then they're looking to see, are you a candidate for IVF? Are you a candidate for a pharmaceutical drug? They don't want you to heal because that's not their medical model. They don't have, there's many, many good Western medical doctors. So I don't want anybody to take this. I think everybody's heart is in the right place.
Yes.
I think it's that branch of medicine is ruled by the medical board, and the medical board is for profit, and that's their protocol. And so they're not going to teach you, take this supplement or eat this food to heal your body, because then you don't need them. Then you're healed and healthy. And it goes really, I find that with many different things, not just fertility related things, but if you have cancer, if you have, whatever disease you have, they're not going to try to heal you from that disease. They're going to put you on a medicine, give you a surgery, give you a diagnosis. And so it's just really 2 different branches of medicine. And one of my goals is for both of us to come together as one and help people heal. But then also, Western medicine has their place. They need Western medical doctors, just like we need doctors like me. So I think we can all live in a world together where we're helping everybody be as healthy and happy as possible. but I don't think we're there yet.
Yeah, I know. I agree. Unfortunately. And I do think there are a lot, I don't want to say a lot but there are some, like whenever I hear clients bring stories to me, I'm like I had a client talk to me about her endocrinologist, and I don't think she's trained in like functional nutrition or anything like that, but she is definitely more like holistic minded. And I forget what it was that she told me, but I'm like, oh my gosh, like this is shocking. Like
right.
the doctors wanting to, help me this, that. And, every now and then I hear stories of my doctor, mentioned blah, blah. So there are some out there, I think, that are trying to be a little bit more holistic minded and maybe more like functional minded, but I agree. And I think I am with you, where I would love to see a world where we can all work together, functional practitioners and Western medical doctors. And I think it's also like a part of recognizing the limitations of each model, right? I mean, again, like you said, we do need Western medical. Like if I break my leg, like I want to go see a doctor in the ER so they can fix it, right? Like if I have an emergency, like I need a doctor. But when we're talking about chronic things, like I just think that there's just this lack of acknowledging really like the limitations of what that model is for. And it's just, we're just not there yet.
For sure. And I think that's a good point you make too, is that Western medicine, if you have a structural issue,
right.
you have a broken leg or something like that, where the body needs to kind of be put back together, that's perfect. But if you need to heal, if you're struggling with, infertility or autoimmune conditions or something where you need the body to heal, then that's where Eastern medicine shines.
Right. Yeah, totally. For sure. Yeah. Okay. I do have one more question I'd like to ask you that I like to ask everybody as we finish up, but can you, you have a few things to share with the listeners. If you can share about your summit and all the things that you have going on, I would love that.
Sure. So I have, first let's talk about the summit. So I do have a summit coming up in January. We run this yearly. It's called the Solving-Infertility Summit. And I interview people just like you to talk about fertility, hormones, and holistic health. And so we are going to gift your audience with the 2022 Solving-Infertility Summit, 7 days free.
Awesome.
But make sure that they check out our 2024, which will air in January. So that's coming up soon. We're recording for that right now.
Awesome.
And we're going to give your audience also a free fertility his and her meal plan, so they can download that, plus get access to that summit I just mentioned at coachkela.com/hopeful-and-wholesome. So make sure you grab that. And I have a new cookbook coming out soon. So we haven't named it yet, but it will be out soon. Just look for my newest cookbook.
Yeah, so many good things. Oh my gosh, this is awesome. So I will have links to all that in the show notes, of course, so y'all can go check out that summit, sign up for the one for 2024. Cannot believe we're saying 2024. It's like not even that far away. It's crazy. So sign up for that. So many good things. Thanks so much. So generous. I love all of this. This is so awesome. Thank you. Okay. So the last question I want to ask you that I like to ask everybody, what do you think is the most important thing you can do to live with purpose?
Yeah, I think be your own advocate, speak up for yourself, and know that these doctors and all the professionals that you're seeking help from, they work for you. And so you need to be your own advocate to really live in your purpose and speak up for yourself and your family. Yeah,
that's such a good advice. I mean, that's advice we can take home. Like we all need to learn how to be our own advocate. So I love that. That's perfect. Yes.
And then one other thing I wanted to mention, my second half of my business is called the Hormone P.U.Z.Z.L.E Society Educational Institute. And it's for anybody that is struggling with infertility and wants to use their pain for purpose and focus on fertility. And so you can become a fertility coach and get certified.
Oh, nice.
Yeah.
Another way to step into your purpose. I love it. That ties in perfectly. So good. Thank you so much, Dr. Kela. Such a good conversation. Thank you for sharing your time and your insight and all the good things that you're doing in the world for all of us ladies out there.
Yeah, thank you.
Thanks for listening to Hopeful and Wholesome, y'all. If you found value in this week's episode, please subscribe on iTunes or wherever you listen to your podcast and leave a review to let me know what you thought. I'd love to know what you find useful in these episodes so I can know how to provide the most value I can to my listeners. And if you have topics you'd like to know more about, I'd love to hear those as well. So shoot me a message on Instagram, Facebook, or LinkedIn. It's at the Hope P.U.Z.Z.L.E, or you can visit my website, hopefulandwholesome.com. Thanks, y'all.